Our presenter, Dr. Shauna Basener, graduated with her bachelor's degree in physiology and her medical degree in osteopathic medicine from Michigan State University. She completed an internship and residency at Ingham Regional Medical Center and joined McFarland Clinic Adult Medicine in 2016. Welcome, Dr. Basener.
Hi, thank you.
Use this because this is not keeping up.
Okay.
There you go.
Let me adjust the sound. I get a lot of feedback on my childlike voice. Can you guys hear me? Okay, I'm gonna turn it up even more. Okay. Well, good afternoon. Thank you for inviting me. I haven't seen you guys in several years. It's been that many years since I actually made a PowerPoint, so this was a big struggle for me. I hope this is helpful. Vicki asked me to talk about sleep, which is a huge topic. It's about a third of every single day. It's a big part of our lives. So what I did was thought about some of the more obvious, common advice that I come up with in clinic, and I asked some other physicians on social media, what would you say if you had the chance to talk to a group of seniors in your community? What would you really want them to know? So I'm going to talk a little bit about that. Okay. The first thing I'm going to just talk about is that sleep is really important. I know we all know that because we feel really bad if we don't get a good night's sleep. We might feel groggy, we might have brain fog, but sometimes I think people just don't have a value for a good night's sleep and they're pushing their bedtime. They're not really valuing that important sleep. Maybe they could get a better mattress, but they don't want to do it. Or the dog sleeps in the bed and it's just a disaster for everybody, which I love my dog, I understand, or whatever is the reason. But sleep is super important. Again, we spend about a third of our life doing that. So it's really important to get good sleep. Sleep is when we get that cleanup of the brain. So what is happening, or what I tell my patients, is I want you to get a good night's sleep because that is when the lymphatic system is basically your janitorial staff of the brain, and it's going through and cleaning up all the junk of the day, any proteins that were made that were mistaken, any issues that came up, and that's when the brain consolidates memory. It's when your body gets to refresh. It's important for healthy aging to get good sleep. It's important for healthy body function. Your immune system will work better when you sleep. During the COVID pandemic, one thing I really ask for my patients to do is please get off social media, get a good night's sleep. That's going to help your immune system. So super important. Am I in trouble already?
I've heard that people online can't hear, so I just need to do a quick check here.
It didn't take long.
Okay. All right, let's try this. Okay, check this. Okay. And
Susan said it's working.
all right, and we'll switch back. Okay. How's that? Is that working now? Perfect. All right. And now back to our regularly scheduled program.
Okay, thank you, Tim. I appreciate that. I think I turned myself up to like danger red volume too, so I'll turn that down now. So anyway, what I was saying is sleep is super important, and I'm just going to ask you to value that. I think the biggest reason that I know sleep is not important is I spent every third to every fourth nights for 3 years doing an internal medicine residency, staying up late, not sleeping in order to get here to stand today. I do think that physicians are getting better at being better sleepers. We're being more protective of our sleep. We're being more protective of the sleep of our colleagues. Physicians are early adopters of new behaviors. So physicians were the first group of people to quit smoking. And I really do see us committing to better sleep. So I'm going to ask you to do it too. This has nothing to do with anything, as you can see, but the word sleep is in this photo. So when you ask for advice on the internet, I had a bunch of screenshots that I saved when I was making this. And when I used my Google search, this picture just kept coming up. That's my middle child. She likes to stick her tongue out. She hates taking pictures. this is why my phone thinks that this was going to help me with this topic, but so anyway, if you're having problems with your sleep, please make an appointment with your physician. Ask for some help. If your physician isn't well versed in sleep, that's okay. We can't know everything. Ask for a referral. Be careful when you're asking the internet for sleep advice, especially when you see things from your friends or social media about this sleep aid or that sleep aid. Definitely let us know what is happening. I always invite my patients, if you're going to try something, it's over the counter, it's probably fine, but start with me first. We used to divide sleep into primary insomnia and secondary insomnia. That's really not a thing anymore. That has been taken out of the major diagnosis books. So we really think of insomnia as an independent problem for people, but we do want to consider other things that might be playing a role in sleep. This is just a meme that I thought was kind of funny, so I hope you guys get a little laugh about it. The body's so tired. Anxiety, we have so much to do. Depression, let's sleep forever. LOL, good luck, says insomnia. And pain says, sup, guys. So there's a lot of psychological factors that can go into poor sleep. We saw people, again, during COVID pandemic, we were so stressed, people were not sleeping. Anxiety can definitely play a role. Often with anxiety, people will find it's difficult to fall asleep. They might be tossing and turning. They might be ruminating in their bed. Depression will also often make people wake up early. None of those are hard and fast. Medical problems could range from pain, joint aches, allergy symptoms, hot flashes. That can definitely be a problem in certain populations. And then I'm not going to talk a ton about other sleep problems like sleep apnea, but if there's an organic sleep problem that you suspect, that is definitely a reason to involve your primary care doctor. So I'm going to move into just talking about some really common things that can interfere with our sleep. I'm going to talk about substances. And of course, I'm going to start with caffeine. We probably use that a lot, mommy's helper, right? How many of us start the day with some coffee? I'm not trying to put anybody on the spot, but coffee is one of the top substances sold worldwide. So it's gasoline and coffee, right? That is what keeps us going, absolutely. But too much coffee can definitely be a problem, especially for the ladies. Unfortunately, our bodies tend to be a little bit more sensitive than the gentlemen, although again, not a hard and fast rule, but something to keep in mind. Caffeine can cause there are a few problems with caffeine. And one of them is the dose. So caffeine lasts in the body for 12 hours. I have a lot of patients who will come and see me mid-afternoon and they're still drinking coffee and they just don't understand why they can't sleep. Sometimes it's an easy fix. So I drink coffee every single day. If you are a Dr. Basener patient, you may have already heard this story. I love coffee in the morning. I drink a glass of coffee every day with full-fat whipped cream that's homemade. I love it. I really look forward to that. So I never tell my patients to drink less coffee than I do. But after that coffee, I am done for the day. It's a real special occasion for me to have caffeine after that. Especially lunchtime, that would be my drop dead, like not having any caffeine because it will really wire me at night and I will not be able to sleep. Caffeine, because it lasts 12 hours, it can interfere with your sleep all night long. And I mentioned that 1 cup because I definitely see patients struggle when they get a higher dose of coffee. So I have several people who actually, I just saw one the other day that one of my patients will end up drinking a pot or 2 of coffee in a day. And that can really be hard on your system. It's hard on your sleep. It can irritate the heart. You can get palpitations with that. So just something to think about. I picked this meme because another thing that I'm really seeing, and I'm not sure if people in this audience would be falling victim to this, but some of the products that I'm seeing have so much caffeine. Some of the drinks, like the refresher drinks, will have like the equivalent of 3 cups of coffee in it. And I don't think people are realizing what they're purchasing. I also have a little mea culpa. I did not realize how much caffeine was contained in chocolate. So that is definitely a problem. this is giving you the dose of chocolate in 100 grams of chocolate. And this is caffeine per cup, so it's not equivalent. I had to do a little bit of soul searching because I have a reason candy problem at night. This has really helped me kind of work on that. Nighttime in my household is the cyanide hour. We're trying to get 3 kids to bed. Reason candies really helped me. And since I was doing research for this talk, I really had some conversation with myself, and I did let that go. I have not had reason candies at bedtime. Thank you. Thank you. And any caffeine product. So I tell my patients, if you're going to have caffeine, I get it. But let's limit it. So think about your total sources, your colas, your espressos, everything, including, sadly, your chocolate, unless you like white chocolate, and that's yucky. So, before I move on, I did want to mention all of these substances also can cause urination issues. The next one I'm going to talk about are alcohol and cigarettes. All three, these are the big 3 devils when it comes to sleep. Caffeine, alcohol, and nicotine in and of itself will irritate the lining of the bladder. Bladders are a special little organ. You guys probably know that. They can really control your life. The lining of the bladder does not like to be exposed to caffeine, alcohol, and nicotine. It can give you nighttime urinary symptoms. So also something to think about if that's a problem that I wanted to mention. Alcohol is a big problem. About 1 out of 4, 1 out of 5 Americans will struggle with overconsumption. One of the problems that I see with alcohol is it's just so common. Like, it's everywhere. Like wine yoga, which makes no sense, right? Like, that's not the point of yoga. So I think because alcohol is so common and we see others doing it, we can fall into the trap of too much alcohol. Especially because alcohol is called a nightcap. So a lot of people think, oh, I should have a little nightcap that's going to help me sleep. And it does. Alcohol will make you feel sleepy. I'm sure a lot of us have experienced that kind of calming sensation at bedtime. It may initially help you fall asleep. But the problem with alcohol, remember, the brain is getting its clean out crew in the night. It's got to clean up the junk of the day. If you're having a nightcap, then that cleanup crew is like, man, now I have to clean up this alcohol. It doesn't get to do its full clean out at night, so you will not get the same restful sleep that you would have gotten without that alcohol. That's the problem. A lot of people, if they're initially sleepy, they will experience poor sleep around 2, 3 in the morning, and they don't necessarily make that connection with alcohol, right? Because it made them feel sleepy, it made them feel good. So that is a common problem. That's a common pitfall. And I've seen that in any decade. So I recently saw one of my 90-something-year-old patients who didn't realize that maybe her nightcap was really interfering in her sleep. That was a huge complaint. And it finally occurred to me to say, well, do you drink any alcohol? And she was having that whiskey nightcap every night. And she was, 90-something. She didn't want to give that up. When you hit 90, it doesn't really feel like my place to tell you to make a ton of changes. I asked her to drink her shot at lunchtime just to enjoy it. And she slept a lot better, so we compromised. So it's just something to think about for you. Also, alcohol is a neurotoxin. I'd like to make that comment. I think we all know that alcohol is bad for the liver. Yes, we've all heard of that before. Alcohol actually can be a cardiac toxin, and it can be a neurotoxin as well. So obviously, if your brain is trying to sleep and it's got alcohol on board, it's not going to help. It's not going to help you feel refreshed the next day. Physicians being, again, early adopters of healthy behaviors, I really don't drink a lot of alcohol. I'm seeing a lot of my physician friends also do that. If I do drink alcohol, I try to have alcohol like with lunch on the weekend. It's a special treat for me. So definitely practicing what I preach there. And then smoking is bad. Please don't smoke. For so many reasons, don't smoke. But a lot of problems with smoking irritates the bladder. You get into needing a cigarette, so you just can't sleep, right? Because you need a cigarette. So I don't feel like I need to spend quite as much time on that one. I'm going to move away from some of the no's into some other things that I get questions about. I get a lot of questions about melatonin. Has anybody heard of that? Yes. Okay. Melatonin is a sleep hormone. A couple of problems with it. It is not regulated by the FDA. It's a supplement. I just want to remind you about that. There's been a lot of conversation lately about the FDA for various reasons, but I would like to make a plug for the FDA. I really like it when I can give you a medication that is regulated and safe. One of the problems with melatonin is I know I can make a guess about approximately what's in it. But nobody is monitoring these factories. Nobody knows. It should be safe. It's relatively easy to produce. A big pitfall I see with melatonin is people they think like, well, if melatonin is going to work for me, then probably like more is better. And that is not the case. I see a lot of comments from sleep doctors, and they are reminding us in primary care, please don't send your patient to me on 10 milligrams of melatonin. They will feel sleepy all the time. Please limit it to 0.5 milligram to 3 milligrams of melatonin if you're going to try it. I keep wanting to say any questions about that. Sorry. I think I say that like 6,000 times a day. Okay, I think that's all I had to say about melatonin. Other than the timing, melatonin is a sleep hormone. It is released by the pineal gland in the brain. So normally the brain would start to secrete that when it thinks, oh, it's time to get ready for bed in 30 to 60 minutes. So when you're starting your wind down routine at bedtime, when it's going to be about 30 to 60 minutes when your head hits the pillow, that would be a good time to take your melatonin. I also want to talk a little bit about sunshine. Natural sunshine is a great medication for us. Sunscreen, yes, don't tell Dr. Snyder what I said about the sunshine. But sunshine is really important. Good sleep actually starts in the morning. That is really tough in Iowa this time of year, right? Especially for people who maybe like me, I drive to work, it's totally dark. I walk into McFarland Clinic, it's dark. My office has no windows, and it might be dark by the time I leave, so I see zero sunshine. So every year in January or February, I go someplace like Mexico. I told my husband we can live in Iowa. That's totally fine, but I have to leave at least once in January and February. And then the other thing I would suggest is trying to get out and take a little walk in the morning if that's an option. If it is not icy, get a little sunshine on your face from the window. Another option or a product that I do recommend is a 10,000 lux light. I chose a picture from Verilux. This is a brand that has been included in a lot of studies on products that are beneficial. I own no stock in this brand. I have no financial incentive, but I do believe in the product. It's like a dose of sunshine. The recommendation is to sit in front of it for 10 to 15 minutes in the morning and let it kind of get you from the side. Do not stare right at it, right? We wouldn't stare at the sun. Don't do that. Most common side effect problem with the device is, especially if you look right at it, it can cause a headache. But this can be a great way to start the day, eat your breakfast, enjoy that cup of coffee with your Verilux. I actually own one of these in my office if you wanted to see one in real life. We really like it. So one thing that I do recommend. I want to talk a little bit about other sleep medications. And I'm not going to spend a ton of time on these. This probably should be a conversation. You know, if you decide to take a medicine, that would be something as your physician that I want to know, or I would want to know. I am a doctor. I am not your doctor, but I want to make some comments. Prescription or over-the-counter sleep medications are super common. Many Americans will use them either chronically, meaning every day, or occasionally. The number one I want to comment on is actually Benadryl. Benadryl is also called diphenhydramine. Benadryl is an internist's least favorite medication. I actually hate Benadryl, especially in this age group. Maybe not so much for the younger folks, although it's not my favorite. I rarely take Benadryl. But the problem with Benadryl is it can give you some confusion. So especially if there's a brain that's already predisposed to some daytime confusion, Benadryl can definitely make that worse. So this is one that makes me nervous. Also in my guys, this can make it really hard sometimes for urine to get past their prostate. So it can cause what is called urinary retention. And sometimes, because again, that bladder is that special flower, right? It's that organ that we really don't think of until it is ruling our life. But if the bladder is full of urine, sometimes there's not a clear connection between the bladder and the brain. We may not realize that that's happening, and it can feel very uncomfortable. So that can be a problem with Benadryl. A tricky thing about Benadryl is it's often not called Benadryl. So Tylenol PM, the PM part means Benadryl. So I always worry a little bit when people tell me that they're taking Tylenol or they're taking an over-the-counter. I like to see it in person. Always happy to have what's called a brown bag session. I'm happy to see the medications. I spend a lot of time talking about what is Tylenol. And Tylenol PM can make that a little bit more confusing. So again, over-the-counter medications are a great option, but I don't want you to think that because they're over-the-counter or you don't need a prescription for me that they're safe and there's nothing to worry about. Benadryl is another one where people will think if one is good, then 2 or 3 is probably better, and then you get more of those dose-related side effects. So definitely see that. Another common thing that I see, I think that's more, I trained in Michigan. I hear this a lot in Iowa. People will say they're taking aspirin. And sometimes they really mean they're taking aspirin, but sometimes that actually means Tylenol. I don't know, like sometimes you guys have dinner and sometimes you have supper. And I've still not quite figured that out. Right? I don't know what the way, maybe one of you guys can fill me in. But always happy to take a look at those pill bottles. When people tell me they're taking aspirin, that is a blood thinner. So when they're telling me they're taking multiple aspirin, I get a little chest pain actually. So always happy to review over-the-counter medications. Benzodiazepines are prescription medications. These can be a little tricky. In my practice, if I reach for a benzodiazepine, I'm usually using this for a short-term solution. The problem with these is it's kind of like giving your patient alcohol in a pill. It hits similar receptors as alcohol would. So it can help with sleep because it helps you feel sleepy, right? It gives you that nightcap. It kind of chills you out. I think it's reasonable for a rescue medication. That's most commonly when I use that. But it can be habit forming. People can need more and more. There is some concern that perhaps this can lead to increased dementia as we age. So definitely not my first choice. Another thing that I don't do is I don't tell people to all of a sudden stop their medication. Let's say that I get a new patient, they're new to me, or they want to make a change. They're ready to talk more about ways to get off their medication. I usually don't stop them cold turkey. Nobody likes that, right? We want to make gradual changes. So these medications generally end in PAM. That's how you can recognize them. A similar medication is Ambien. Ambien is a non-benzodiazepine benzodiazepine receptor agonist. So there's one for the quarter barrel for you. Ambien, super common. This is another one where ladies need to be a little bit more careful than the gentlemen. Gentlemen can go up to 10 milligrams reasonably safely. Ladies, our bodies just don't excrete this in the same way. So the 10 milligram dose can really hang on. So this is when we see people have a lot of side effects the next day. They're still a little groggy. They're essentially hungover. They're getting in their car to drive wherever they're going to go, and they're hitting the mailbox. They're getting in car accidents. So the dose there can be important. Ambien, in my practice, I do prescribe it. I like it. I think of it more as a rescue. And if somebody's been on Ambien for a long time, I try and talk about how we could maybe make some changes. Could we decrease the dose? Could we do, other options? Again, I would never just stop it all of a sudden. I just think that's kind of cruel. We'll talk about that in a few moments. You want to give the brain other things besides Ambien when you're getting ready to take it away. Ambien's not bad. I don't want people to think if you're taking it that your doctor's making a mistake for you. Again, I am a doctor. I am not your doctor. So if you're using any of these medications, this may be a chance to just review what makes sense for me. They're definitely options. The next type of medication I'd like to just mention to you is orexin receptor antagonists. I'm not going to talk about these a ton because they are stupid expensive, like $800 a month for this prescription medication. It's pretty ridiculous, I think. I don't know. Can anybody do $800 a month? I mean, I can't, right? So I have prescribed this medication only one time. Have I gotten it into the hands of my patients? I thought this patient really needed it. This was a special circumstance. This patient was also working on issues with Dr. Clemens, so this was collaborative. It didn't really help that patient, so just my experience of one. But I hope that this medication becomes more available to us, and this is a reflection of increasing research that's being done on sleep. This medication, the goal is to give a more physiologic sleep. So remember we said like caffeine works against us, alcohol feels like it's our friend, but maybe it's actually our frenemy. Orexin is a chemical in the brain that can affect sleep. And the hope is that this medication can give people a safe, restful sleep. So hopefully we'll be able to talk more about this in the future. These medications were not available when I was in medical school, so they're kind of newer to market. So just exciting things to keep our eyes on. Antidepressants are also options for some people who are really struggling with sleep. Remember I said sometimes depression and anxiety can really interfere with our sleep. And sometimes you really need to address one or both or all three of them together. So these are just some options. I don't have a ton of comments about them other than just to mention these are not the benzodiazepine type medications, so we have less concerns about confusion the next day. They're not like Benadryl, so less confusion about that. So those may be other options. Doxepin, trazodone, we used to use those in much higher doses for depression and anxiety. But for many reasons, we don't do that anymore. One of them was they made people so sleepy, like they couldn't stay awake during the day. So those may be options as well. I want to talk a little bit about sleep environment. This is going to be kind of a choose your own adventure part of what I want to say to you. There's a lot of controversy here, so you have to decide what works for you. I'm going to make some general comments about things that you might not notice are interfering with your sleep. The first one is TV in the bedroom. Please take the TV out of the bedroom. In general, it works against you. I hear people will tell me that it works for them, but usually we're talking about their sleep and they're telling me that something is not working. So my question is always like, well, gosh, is it really working for you? That noise is really stimulating for the brain. It can keep the brain awake. Brains like TV, right? We like to watch TV. Same with smartphones. Brains love smartphones. Who has a smartphone? Anybody? Yeah. And does anybody want to admit they maybe struggle with their smartphone? It calls to me, and I see everywhere I go. I know it's not, we think of this as like the kids are all on their phones, and that is definitely true. But I like to point out to my children who are very deprived and do not have smartphones. Everywhere we go, I like to say, look at all these people. They're just on their phones. Like, in my opinion, if you're at a restaurant, you should not be on your phone, right? Like, you should be talking to whoever you're with. So they definitely call to us. I see people driving when they're on their phones. I almost got hit in the parking lot last year because someone was on their phone turning. I mean, guys, look, this is a hospital. Put your phone away, right? Like, I shouldn't get hit in the parking lot. It was fine. I don't want to be dramatic, but our phones are really sucking us in. They're keeping us awake during the day. They're drawing us in. One of the questions that I have added to my routine when I do a physical, I almost always will say, do you buckle your seatbelt? No texting and driving, and because they're really becoming a problem. And they're really blowing up our brain. So please put your phone down to get ready for sleep. When your brain is like pressing all those buttons, it's super engaged, it's really liking that, you're getting a little bit of dopamine from that. Remember, dopamine is the hormone of pursuit. It feels good. We get a little dopamine when we buy something new, when we eat chocolate, not white chocolate, we don't eat that. Maybe you guys do, I don't know. So please put your smartphone down several hours before sleep. It does not need to live next to your bed. Do not put it on the nightstand, put it in the other room. It's gotta go. Comfortable spaces, temperature, and bed partners. This is a place where you guys are going to have to decide what works for you. Some evidence that a cooler environment is better. I think there's a lot of variation about temperature. We learned this again going through COVID pandemic. Temperature was defined as normal when we really didn't, a century ago, we didn't really have great accurate thermometers. Especially going through pandemic, we saw that temperature exists in a range of normal. I know this because I had my temperature checked every single day for months, right? So the recommended temperature for sleep is 68 degrees, but that will vary for you, so you can play around with that as well. This is a picture of my daughter. She is sleeping on the floor. She went through a long phase where she would sleep on the floor. I don't know why she did that, but it worked. But I'm going to make a plug for the very most comfortable mattress, pillows, whatever works for you. I'm going to also ask you, if you're going to buy an expensive mattress, go lay on it first. This is so sad. When I've had over the years, several patients have told me, I really thought I should invest in my sleep. I agree. I think we should have the very nicest sleep environment that we possibly can. I love my mattress personally. I love my sheets. But do try to sleep on it first. It's so sad when someone buys an expensive mattress and they really hate it. I'm not making a plug for any product. I've had patients complain that they've invested in Tempur-Pedic. I had one patient who bought the Sleep Number bed. Oh, she hated it so much. It was so sad. And then I think she missed the return window. So something to think about. Bed partners is also a place where I'm gonna step gingerly into that conversation. Because some of you guys sleep with your spouse or your partner, whoever it is, or your cat or your dog, whoever. I am a parent. I have a dog, but I really try to not give people parenting advice. I don't think anybody knows how to parent. So I'm not going to tell you, I'm definitely not going to be one to tell you what you have to do with your pet or whatever. But I'm going to gently say, if the dog is interfering with your sleep, is it possible the dog could sleep in the cage? Or is there some sort of solution to this problem? This is probably next level. You guys are probably done with this part of your life. This is my middle child again. This is the one who hates to be photographed. So sometimes you have to wait until she's asleep. But she's so cute, right? Studies have shown that when one partner is moving around in the bed, even though the other one thinks they are sleeping through that, their brain, right? Their brain who's interested in the other one is not getting to that restorative sleep the way that still calm partner thought. So it's possible that, whatever, if there's an organic issue going around for that bed partner, if they have sleep apnea, if they snore, if they have restless legs, if they're kicking you in the night, that other partner might really want to talk to their doctor. I also want to mention, sometimes I make my husband sleep in the guest bedroom because he snores really loud. And I love him. We are happily married, but I really want to kill him sometimes. I had him do a sleep study. It was negative. I made him buy a dental device to stop his snoring. He hated it. He really hated it. He really tried. God love him. And I'm mentioning that to you not because I'm just trying to talk about myself, because sometimes people don't realize, you can do that? Yes. Sometimes the snoring partner has to sleep in the guest bedroom, and that's okay. We were actually recently on vacation, like I mentioned to you guys, and the wife was just so tired that we were talking to. The husband was snoring so terribly. And my husband mentioned that he sometimes has to sleep in the guest bedroom, and the female of the partner was shocked that that was an option. So if you have a guest bedroom, use it, right? That's what it's there for. It's okay. Doesn't mean that my marriage is in trouble. It doesn't mean anything. It just means love ya, but you're on my last nerve and I'm ready to kill you. So something to think about. I don't know if my husband realized I was going to tell you that today, but don't tell him. Another medication I want to talk about a little bit is exercise. One thing that I hate to hear, or maybe I shouldn't say hate. It's super cringy when people tell me like, oh, I just like to go for a walk every single day, Dr. Basener. Every single day of my life, Dr. Basener, I take a 3-mile walk and that's it. I don't really exercise. Yes, you do, right? Walking is great exercise. So I really want to encourage some form of exercise for many reasons. In the context of why I was asked to come here today, exercise will help you build sleep pressure. That is the feeling that you get when you're on the couch at night and you're like, man, I really need to go to bed. So any old exercise works for me. I don't think that there is a best option for exercise. Again, walking, great exercise, 20 to 30 minute walk a day is really evidence-based to help you sleep better, age better, help with memory. And walking is very enjoyable for most people. If you really hate that, don't do it, okay? Exercise means move your body in a loving way. So if you hate it, don't do it. If you don't really want to do it and then you start doing it and you're like, oh, this is really nice, I'm going to keep doing my walk, that is normal. That's okay. I have a lot of patients who tell me like, oh, I'm just so lazy. I never want to do my exercise. That's normal, right? Like even Olympic athletes have to put their workouts on the calendar because they don't want to go to the gym either. They're just like us. So walking, I will make a plug for maybe taking a walk in the morning. Remember to get that morning sunshine. But if that doesn't work for you, that's totally fine. Perfection is the enemy of good enough. Do something that you enjoy. Don't walk on the ice, okay? One of the last things that I wanted to talk about is CBTI. This is super important. I think if I could leave you with one thing, and I could send you after some links to some other options. These are just some websites and ideas. I was going to add, this is a sheet from a Canadian site about sleep hygiene. So really great resources on CBTI. Well, what is CBTI, Dr. Basener? I've never heard of that. Let me take a few moments to talk about this. Cognitive behavioral therapy for insomnia is super exciting. A lot of evidence and research shows that this can be just as effective as any of the other things that I've talked about. So cognitive behavioral therapy for insomnia can help you and give you as long of lasting results as like that Ambien initially can. So lots of good resources for cognitive behavioral therapy. What this is basically reteaching your brain how to sleep. So sleep is a skill in some regards. We don't think about it in that way, right? But sometimes if you're really struggling to sleep, if you can't fall asleep, if you're waking up early, if you wake up in the night and you can't fall back to sleep, you're really struggling. CBTI can be a great option to retrain your brain how to sleep. So if something has come up, like you dealt with a baby who messed up your brain, right? I've done that 3 times. I really had to work to teach my brain how to sleep after all that. So I definitely believe in this. I would do it myself. What you're doing is usually, I'll kind of back up. The ideal thing would be as your physician, I would send you to a class or you would learn CBTI. There is no such class that I'm aware of in Iowa at all. So that's not really an option, but so what these websites are and resources are some online resources, some apps and some books where you can work through CBTI independently. The good news about this is that when patients are self-directed, they can get as good of results going through one of these programs themselves if they're committed as if they were to go through a class. So the first one is a Mayo Clinic class that you can take online. I included this one first because I think in our region, we really look to the Mayo Clinic, right? If Mayo Clinic says that's what you have to do, then that's what we're going to do. So Mayo Clinic has a free class that you can take online. It can really be helpful in reteaching your brain how to sleep, dealing with those like, waking up at 3 a.m. and starting to go through your list. This can give you a lot of helpful suggestions. And evidence would show us that this can give you long-lasting sleep benefits for years and years after you do the program. So very effective. I talked about some sleeping pills earlier more as a rescue. I want to circle back to that concept. When you learn the skill of sleeping, that can last you years and years. A lot of times, one of the problems with sleeping pills is they help us initially. They give us some sleep. They rescue us. We were feeling super exhausted. We needed some help. But we end up staying on those medicines, and they're really not helping anymore. So cognitive behavioral therapy can be a really great program to start if you're thinking, you know what, maybe it's time for me to get away from my medication. Maybe it's not actually working as good as I think. Remember I said I would never stop your medication cold turkey. I would never do that. I would talk to you about learning the skill of sleep, and then working away from some of the other tools that you may have been working that maybe are not so effective anymore. And I think that was all I wanted to talk. So I'm a perfect 40 minutes, right where I wanted to be. So now I can say what I always say, which is, are there questions?
First, I'm going to ask Tim if there are any questions online. Okay, all right. First one with their hand up, I'll come find you.
Two questions.
Okay.
How accurate are these Apple Watches that track your sleep?
They're for entertainment.
Okay. And the other one is the quality of sleep, because that's another, it's related to the Apple Watch, but the
Yeah.
quality of what you have.
I think they're for entertainment. I don't mind when people have Apple Watches, but if they're, this is a Whoop. I like it because it allegedly keeps track of my sleep and my sleep quality. It feels supportive to me. I can keep track of myself. It gives me some accountability. So do I like these products? Yeah, I do. I use one. I like it. I think that it works with my life. I work with the machine. It helps me, sometimes it will tell me you are overextended, and I'll use it to give myself permission, oh, you're right, I am overextended. I need to reel it in. Sometimes I need that. I work full time. I have 3 kids. Sometimes I just need more rest. So I do like it for that reason. As far as do I use it to help me decide if you have an organic sleep problem, I really don't. It doesn't really help me with sleep apnea, restless legs, those types of things. I think they have a role. The reason I don't wear my Apple Watch is I really hate it. I own one. I actually need to sell it if somebody's interested. I just don't like it. That's why I don't use it. I like the Apple Watch for other reasons. I do like the heart rate function for certain of my patients. I'll just throw that out there. Some of the devices can monitor your heart rhythm. That can be super helpful. It is still for entertainment, but it is really helpful if you're a patient who has certain heart rhythm problems to monitor that. Some of my patients are super savvy. They'll send me a screenshot with the heart rhythm. The problem with those is I just want to offer reassurance. If you decide to use one of those products, it overcalls heart rhythm products or problems. So I do find that in certain anxious patients, it can work against them. Sometimes I have to ask people to stop checking. I think they're fine on the right wrist. Does that answer your question? Maybe that was more than you bargained for. Okay.
What can you tell us about the cost and availability of a 10,000 lux light?
They're $40, $40 to $80. You can get them on Amazon. They're super easy to return, low investment if you don't like it. If you decide to invest, try it for at least 2 weeks, see what you think. If you don't like it, return it, usually for no money lost. I've never had a patient buy one and return it. It feels good. I like it. If you're in adult medicine, you can come stand by my light for a few moments. It's a moon. It's very aesthetically pleasing.
Any more questions? Yes?
You really didn't say a lot about urination, particularly in men,
Yes.
other than avoid drinking something late and alcohol and so on. Do you want to make further comments, or would you, or
I could, yeah, I
prostate?
could. I'll say a couple things. Again, I commonly see people struggle with bladder irritants, caffeine, alcohol, spicy food. I'll make a couple comments just like in general. Nighttime urination is a big topic. I think you could have several community talks on this. I think what I want to say is it can just feel so hopeless to be urinating all night. If that is you, please talk to your doctor. If your primary doctor can't help you, please see a urologist. If you're a female patient and you need a certain referral, we could talk about that after the break. I think what you're asking me is it's very common as we age to have an enlarged prostate, and it can be hard for guys to get the urine out completely. If you start to notice those problems, I don't want to talk a little bit or a ton about over-the-counter supplements that guys are taking, but talk about that with your doctor. There's prescriptions, procedures for that. I will mention that sometimes actually you can have sleep apnea that's waking you up, and patients will interpret that to mean they have to get up to urinate. So in my practice, I will often ask somebody who is struggling to get up to pee in the night. I will make sure that they don't need a sleep screen before offering them a medication for their prostate or a referral to urology. So that's a common one that I see. I hate to send someone to Dr. Deitch or Dr. Correct, and they're like, Basener, obviously they had sleep apnea. Maybe you should have dealt with this. Another comment that I'm going to make is another problem with urinating in the night can be if you have swollen legs during the day. That's a really common problem. And what happens is when you lay down, that swelling in your legs gets to go up to your kidneys, and you will make urine in the night. So if my patients have swollen legs, that can be a sleep problem. Another common thing that I see with urinating a lot is constipation. Constipation is the bully of the bladder. So people, if they have a colon full of poo, that is pressing on the bladder. The bladder doesn't like that. So that's another super common problem that I see. I think there was one more that I was going to comment on. So anyway, I have a lot that I could say about, oh yes, this is what I was going to say. I also ask my patients usually to drink more water. That's a common recommendation that I might make. But if they're doing that, I ask them to, this is, again, I don't know when you guys eat dinner or supper or whatever you do. So I ask you to stop drinking water in your evening meal, which I call dinner, or you may call supper. The reason is if you're drinking liquids after dinner, it takes the kidneys 2 to 3 hours to turn that into urine. So if you're drinking water or alcohol or whatever right before you go to bed, then you are going to need to wake up to go to the bathroom 3 to 4 hours later. So that can be a problem as well. So those are some things that I would say.
Well, I have a question. I haven't been able to sleep all night forever. And so I've been taking gummies, which still aren't helping me sleep, but
Okay. Like,
Maybe-
are we talking about like CBD?
CBD
Okay.
gummies, yeah. And, I guess they relax me more, but I'm still, I still do not. I wake up 2 or 3 times in the night.
Yeah. So obviously, if I saw you in clinic, I would ask you a lot of questions. Why are you waking up? Are you in pain? I will make the comment, I don't have a lot of opinions about like CBD products. Again, I wish they were regulated. I don't know what you're getting, so it's hard for me to really comment. Marijuana is a depressant. So especially if sleep is involved, I think that can really work against people. I'm not a person, I think like the marijuana crowd is generally like marijuana is super bad. We should never use that ever. And I don't know if that's really true. Or they're like marijuana is the cure for everything and it should be legal for everyone. And that is definitely not true. So if it's not working for you, definitely not uncommon. If it sounds like you're a lifelong bad sleeper, maybe.
No, not
No?
really. I used
Okay.
to and I fall asleep.
Okay.
I mean, the minute my head hits the pillow, I'm out. But it's only like for 2 or 3 hours.
Okay.
And then I'm awake for an hour. And then I'll go back. And next thing I'll know, I guess it's 3 o'clock. So I guess I went back to sleep again.
Okay. What are you doing in that hour?
I'm lying there.
Okay.
I elevate my bed. I go up, I down.
Okay. Yeah.
I won't get up. I make myself stay there.
Okay. When did this start?
Oh, gosh. I don't know, 3 or 4 or 5 years ago.
Oh, so it's been going on for a while. Is it okay that I'm asking you these questions? I'm naturally a nosy in person. I'm nosy by profession. If you don't want to air your tea in front of the room, we definitely don't have to. But I would say that for several years, if you've been a bad sleeper, this is moving into that chronic insomnia place. And I would definitely ask you, try some of that cognitive behavioral therapy for insomnia. A couple things that you want to make sure you're not waking up because you're having pain, sleep apnea, things like that. Those are the things that I would talk about with you more in clinic. But the solution for you might surprise you. When you go through cognitive behavioral therapy, what they'll ask you to do is make an inventory of your sleep. It might actually be helpful to get up. You're saying you're thinking, oh, I better make myself stay in bed, right? Like that is what makes sense to me. Totally get that. However, the bed really should only be for sleeping and having sex. It should not be for laying there frustrated because you're doing neither of those, right? So you train your brain, okay, it's 11 o'clock. It's time to wake her up and be annoyed for an hour. And that can be a pattern where you can learn to say to your brain, like, okay, brain, like, I know that we used to do that, but we don't do that anymore. What we're going to do is walk through our boring grocery list, and then we're going to fall asleep. So I would ask you to take a look at some of those resources.
That makes sense.
Good question.
Yeah, that's just, my dog knows what time it's time for breakfast and dinner, right? He knows. He's ready.
Your slide on chocolate time blues, again, you're suggesting that better, I mean, I probably should avoid chocolate all the time, but
No,
I tend,
no, that's not what I said.
well, it's probably a good idea, but you're saying
I'm gonna
particularly in the
disagree.
afternoon or the evenings?
Evening. Now, maybe for the guys, they're not as sensitive. I'm saying for me, 8 reason candies to get my kids through the bedtime process is not reasonable. It's not working for me. I need to be a little bit more like, mature about that. But I do have 3 of them, and 3 is a lot. I would never tell anybody to never drink chocolate or never eat chocolate. And I want to make a comment on this. This has nothing to do with why you invited me here, but I feel super passionately about this. I think Americans get really confused about, like, they don't eat this because it's bad food, right? Has anybody ever said, well, that's bad, I shouldn't have that? Well, this is a good food, I should choose a good food. This is just nails on a chalkboard to me. There is no good food. Right? There's no bad food. Food has no moral value. It may have nutritional value. It may not. It may accomplish your goal, but sometimes your goal is to sit and enjoy some chocolate. And that's okay. What I have chosen to go through with my kids, they have even come home from school and they have been taught what are good foods and bad foods. And I just, like, oh. So ice cream is bad? So mom is bad if she takes us out for ice cream in the summer? No, that's what you do in the summer in Iowa, right? You go to the Van D's and you get an ice cream cone with like 8 eyeballs on it. Like, that's what you do. So I, again, feel super passionately about this. I would never ask anyone to give up their chocolate. If my doctor, Dr. Callan, told me I have to stop eating chocolate, I would fire her and get a new doctor. Chocolate is a sometimes food. So sometimes we should enjoy some chocolate or whatever. Maybe you guys like white chocolate. I don't know. That's totally fine. Don't offer that to me. I'm totally kidding. I'm saying let's ask ourselves the question, is it working for me? I think a lot of times people will come in and ask me, like, should I do this or should I do that? And I think they get lost. They get lost for the forest and the trees, right? It doesn't work for me if I eat a bunch of candy to get through the bedtime process. Right? That doesn't make sense. I can put my kids to bed without 8 reason candies. I'm not even enjoying them. I'm like secretly eating them behind my kids' bed. It's like shameful, right? This is not working for me. I think I am maybe. I think it does kind of affect my sleep. So if you're doing something, I want you to ask yourself, is it working for me? I am not the expert in your body. I'm an expert in bodies in general. And so I'm going to suggest to you, like, I'm going to ask you a bunch of questions. I'm going to figure out what's going on. If it's not working for you, I'm going to make some suggestions to change that.
I grew up on a farm in Iowa.
Mm-hmm.
Dinner's at noon.
Okay.
Supper's at 6. But going out for dinner at a supper club is confusing.
You know, that is really confusing. And I'm married to one of you. And sometimes they have supper at noon and sometimes it's supper at night. I don't think there's a way. I don't know. But thank you. Maybe I just have a block about the fact that I live in Iowa. Maybe I just won't accept it.
In terms of melatonin,
Yes.
can you get enough through open, or not open, but through windows, sliding glass doors, that kind of thing to meet the need?
That is a really good question. So sleep really, I think I talked about this a little bit, but I'll kind of start in the morning. Sleep starts in the morning with cells in the brain that their only job is to keep track of what time it is. So that's why I want you to wake up, get out of bed, get some sunshine on your face, tell your brain, hey brain, it's time to be awake. Because then brain knows in 12, 14, 16 hours, we're gonna get ready for bed. So melatonin is a sleep hormone secreted by the pineal gland when it gets close to bedtime. If you think that is your problem, absolutely, a melatonin supplement is a reasonable thing to try. If I have a younger patient who's taking melatonin and they love it and it really works for them, I don't say stop taking that. You know, people are very emotional about their over-the-counter interventions and what is working for them. But usually I start to recommend melatonin in your 60s, 70s, 80s, because that's the time that the brain doesn't make as much of that hormone.
Get it through the open glass kind of thing?
Well, it depends on what your brain does. If making those adjustments doesn't work for you, or let's say like melatonin is an option and you want to try that and make some other adjustments that make sense, totally reasonable to try multiple reasonable things at a time. Melatonin can also just be for days where you feel like, man, I feel like I need just a little bit more help with sleep. I definitely have patients who take it every day. If it's working for my patients, I don't intervene. But if they're taking too much and they're always sleepy the next day, I say, hey, maybe you should rein that in. And I don't bring it up with my younger patients. Their brains don't tend to need it. There's no test that's available to me commercially where I can say, this is what's going to work for you.
Okay. Tim, any more questions online? Nope. All right, we'll take one more question then.
I didn't have as much problem as I seem to have now. I do a lot of traveling, and so I fly. And have you go to Asia or whatever, and it's flying overnight, or Europe overnight. Suggestions of how to sleep on airplanes, or what you should prepare before you get on the plane.
You should get into credit card points so you can upgrade your seat, so you can
Not
recline.
happening, I'm sorry.
So you should think about that. Things that I would pack, I would think about which direction I was moving. I would think about I would buy the best plane ticket I could afford. I have not traveled to Europe since my kids were young. I've not done a long plane trip in a long time. So I don't know what I would actually do. I'm kind of tired, guys. Like, I have a lot of health problems. I have so many kids. I don't know if I could plan a long trip. But what I would say to my patient is try to get the most comfortable seat that you can. Pack things like an eye mask. A product that I do have and love is a Manta sleep mask. Another doctor said she used it. She does night shifts. It keeps all of the light out of my eyes. So my husband, God love him, we have so many like night lights in our house because he doesn't want anybody to fall. And I don't tell him I said this. I actually a little bit hate it because it is so bright. I find it really irritating. So I just bought this sleep mask. It really helps me. I would pack that if I were traveling. I would use an app that I believe is called Time Shifter. I recommend that for people who do overnight shifts and who are also traveling internationally. And then you can also look at some of these CBTI resources, and the topic you're looking for is called chronotherapy. That will give you more advice on that topic. Okay. Thank you so much. I appreciate your attention.
All right, thank you again, Dr. Basener, for your time in preparing and presenting this program. Very good. We have a couple of programs coming up I'll remind you about. Don't Stress Your Heart Out, Wednesday, February 12th, 2 p.m. at the 60 Forward Center. And then on February 25th at 2 o'clock, back at 60 Forward, Skin Cancer, Who's at Risk, Making the Diagnosis and Treatment Options. Then February 26th, my birthday, Coronary Artery Disease at 60 Forward as well. So we hope to see you there, and thank you for joining us today.